You're listening to the Commonwealth Club of California. This is our radio program. Our panel tonight is titled Immigrants and Healthcare. Our panelists in this discussion are Fabian Nunez, 46th District California Assembly Speaker Ellen Wu, Executive Director of California Pan-Ethnic Health Network Jane Garcia, Chief Executive Officer of La Clínica de la Raza Dr. Alice Chen, Medical Director of the General Medicine Clinic at San Francisco General Hospital and Assistant Clinical Professor of Medicine at UCSF. I'm Brenda Wade, your moderator.
We have a broken and fragile healthcare system, the best care for the haves and only emergency care for the have-nots. You got to provide preventive care to people on the front end.
You heard earlier that the system is broken. Absolutely. If we have to create emergency rooms to be the homes for people for primary care, then you've already lost the battle in terms of cost expenditures, in terms of continuity of care, in terms of quality.
Poor immigrants in particular face multiple challenges. The first one I would say is lack of affordable insurance. The second issue is helping patients navigate an incredibly complex and fragmented bureaucracy, otherwise known as a U.S. healthcare system. Add to that language barriers and literacy barriers. Immigrants come to the United States primarily to work, not to access the healthcare system.
Undocumented immigrants are less likely to go to the doctor when they're ill than are legal residents.
Immigrants pay more out-of-pocket costs than anybody else. I think the real question is, can we afford not to provide the services? And I'll tell you, we spend a tremendous amount of money in administrative costs keeping people out of the system. I'm working with a hospital right now, and we're taking a look at their data in terms of the inappropriate usage of the ER for a primary care home. It was quite amazing how many folks are using that as a source of primary care services. And so actually we're having some discussions about how might our community health centers step up to the plate and divert some of those cases.
Really making sure that our neighborhoods and our communities are safe and promote health. The majority of our health status is actually determined by those factors and not our ability to access our healthcare system. Only about 5% of our healthcare expenditures goes towards prevention and public health. I just want to remind people again, it's a continuum of care. To my mind, it's a pyramid model. Hopefully all of us will be in the preventive tier, some of us will be on the primary care tier, and very few of us hopefully will need the hospital care and the acute care, but when you need it, it has to be there. The hard part about primary prevention is behavior change. And it's too easy to say, let's incentivize people to exercise and eat right and do all the good things, because if it were easy, America would be a lot thinner. Our immigrant population is a huge driver in our workforce. If that workforce isn't really a healthy, thriving workforce, then we really all pay.
Here's a stat for you from Children Now. Half of California's children live in an immigrant family. So as we look at an aging population and we look at who's going to be taking care of us, who's going to be paying into Social Security, who's going to be the workforce of the future, then you have to look at the children, and the investment needs to occur now.
Our thanks to our wonderful panel for their informative remarks. Fabian Nunez, Ellen Wu, Jane Garcia, Dr. Alice Chen, thank you so much.